Hello, my dear friends. Welcome back to Senior Daily Living. I'm so glad you're here with me today. You know, I hear this all the time. My doctor said my blood pressure is 130/80. But what does that actually mean? Or, is my blood pressure good or bad? I'm just not sure. If you've ever felt confused when looking at those two numbers on your blood pressure monitor, you're not alone. Millions of seniors have the same questions. And today, we're going to clear up all that confusion together. Understanding your blood pressure numbers isn't just about memorizing what's good or bad. It's about taking control of your health and knowing exactly what's happening inside your body. And I promise you, by the end of this video, those numbers are going to make complete sense. So grab a cup of tea, get comfortable, and let's have a friendly conversation about what your blood pressure numbers really mean and why they matter so much for your health. Let's start with the basics, because understanding what blood pressure actually is will help everything else make sense. Think of your heart as a pump and your blood vessels as a network of garden hoses running throughout your entire body. Every time your heart beats, it pushes blood through these hoses to deliver oxygen and nutrients to every part of you, from your brain to your toes. Blood pressure is simply the force of your blood pushing against the walls of your blood vessels. It's a bit like the water pressure in those garden hoses. Now here's the important part. Your heart doesn't push blood at the same pressure all the time. When your heart squeezes and pumps, the pressure is higher. When your heart relaxes between beats, the pressure is lower. That's why you always see two numbers when you check your blood pressure. These two numbers tell the story of what's happening during both parts of your heartbeat. And just like water pressure that's too high can damage your garden hose over time, blood pressure that's too high can damage your blood vessels and put stress on your heart, kidneys, and other organs. But don't worry. Once you understand what these numbers mean, you'll be much better equipped to keep them in a healthy range. Let's talk about that first number, the one on top. This is called your systolic pressure, and it's the higher of the two numbers. Now, I know systolic sounds like a complicated medical word, but all it means is the pressure when your heart squeezes. Think of it this way. When your heart contracts and pumps blood out, that's when the pressure in your arteries is at its highest. That moment of maximum pressure is your systolic reading. For example, if your blood pressure is 130/80, that 130 is your systolic pressure. Here's what the numbers mean. Normal is less than 120. Elevated is 120 to 129. High blood pressure starts at 130 or above. Your systolic pressure is especially important as we get older. Many seniors find that while their bottom number stays normal, their top number creeps up over the years. This is partly because our blood vessels naturally become a bit stiffer with age. This number is so important because high systolic pressure means your heart is working extra hard with every single beat. And that can lead to serious problems like heart attacks, strokes, and kidney disease. But here's the good news. This is a number you can influence. Through healthy eating, regular movement, managing stress, and sometimes medication, you can keep this number in a healthy range. Now let's move to the second number, the bottom one. This is your diastolic pressure. Diastolic pressure measures the pressure in your arteries when your heart is resting between beats. It's that quiet moment when your heart relaxes and refills with blood before the next pump. Using our earlier example of 130/80, that 80 is your diastolic pressure. Here's what the numbers mean. Normal is less than 80. High blood pressure starts at 80 or above. Think of it like this. If your systolic pressure is how hard your heart works, your diastolic pressure is how much your blood vessels resist that flow when your heart is at rest. Your diastolic number is important because it shows whether your blood vessels are relaxed and flexible or tight and stiff. When this number is too high, it means your heart never gets a proper rest, even between beats. For many seniors, the diastolic number might actually be normal or even a bit low, while the systolic number is elevated. This is very common and still needs attention because that top number is doing most of the damage. However, if both numbers are high, that's a sign that your cardiovascular system is under stress from multiple directions, and it's definitely time to work with your doctor on a plan. Now that you know what each number means, let's talk about the categories your blood pressure might fall into. I want you to grab a piece of paper because these are important to remember. Normal blood pressure, less than 120 over less than 80. This is exactly where you want to be. Your heart and blood vessels are working beautifully together without extra strain. Elevated blood pressure, 120 to 129 over less than 80. This is a warning sign. You're not quite at high blood pressure yet, but you're heading in that direction. The good news? This is the perfect time to make lifestyle changes before you need medication. High blood pressure, stage 1, 130 to 139 over 80 to 89. At this stage, your doctor will likely talk with you about lifestyle changes and possibly medication. This is manageable, but it does require attention. High blood pressure, stage 2, 140 or higher, over 90 or higher. This is more serious and almost always requires medication along with lifestyle changes. But please, don't panic. With proper treatment, many people bring their numbers down successfully. Hypertensive crisis. Higher than 180 over higher than 120. If you ever see numbers this high, this is a medical emergency. Call 911 or get to an emergency room right away. Don't wait. Now, one important thing to remember. One high reading doesn't automatically mean you have high blood pressure. We all have moments when our pressure goes up, like when we're stressed, in pain, or have just exercised. Your doctor will want to see a pattern of high readings over time before making a diagnosis. That's why keeping track of your numbers at home can be so helpful. You might be wondering, why is all this so important, especially for someone my age? Well, my friends, as we get older, our risk of high blood pressure increases significantly. In fact, about 2 out of every 3 adults over age 60 have high blood pressure. So you're certainly not alone if you're dealing with this. High blood pressure is often called the silent killer because most people feel absolutely fine even when their numbers are dangerously high. You can't feel high blood pressure the way you can feel a headache or a sore knee. But here's what those high numbers can lead to over time. Stroke, which happens when high pressure damages blood vessels in the brain. Heart attack and heart failure. Kidney disease and kidney failure. Vision loss from damage to the tiny blood vessels in your eyes. Memory problems and dementia. Damage to your legs and feet, making walking difficult. I'm not sharing this to scare you. I'm sharing it because understanding the risks helps you take those numbers seriously. And here's the wonderful part. When you keep your blood pressure in a healthy range, you're protecting yourself from all of these problems. You're investing in more years of independence, more time with your loved ones, and a better quality of life. Let's talk about how to check your blood pressure correctly, because getting an accurate reading is so important. Before you check, avoid caffeine, exercise, and smoking for at least 30 minutes before. Use the bathroom first. A full bladder can raise your pressure. Sit quietly for 5 minutes before taking your reading. How to check properly. Sit in a comfortable chair with your back supported. Keep your feet flat on the floor. Don't cross your legs. Rest your arm on a table at heart level. Make sure the cuff fits properly around your bare upper arm. Stay still and quiet while the monitor is working. Take 2 or 3 readings, 1 minute apart, and record them all. Best times to check. Most doctors recommend checking at the same times each day, usually in the morning before breakfast and medications, and again in the evening. But always follow your doctor's specific instructions. One important tip. If you get a high reading, don't panic. Wait a few minutes, relax, and check again. Stress and anxiety about the reading itself can make your pressure go up temporarily. If it's still high after a couple of checks and you're not having symptoms like chest pain or severe headache, call your doctor's office for advice. Don't rush to the emergency room unless you're experiencing symptoms or your numbers are in crisis range, over 180, 120. Now, for the empowering part. There's so much you can do to help bring those numbers down or keep them healthy. Reduce your salt intake. Most seniors eat far more salt than they realize, and salt makes your body hold on to water, which raises blood pressure. Try to stay under 1,500 milligrams of sodium per day. Read labels carefully, because processed and packaged foods are loaded with hidden salt. Move your body. Even gentle activity helps. A 30-minute walk most days of the week can lower your systolic pressure by 4 to 9 points. That's as effective as some blood pressure medications. Start slowly and build up gradually. Eat more potassium-rich foods. Foods like bananas, sweet potatoes, spinach, and beans help balance out sodium and relax your blood vessels. Talk to your doctor first if you have kidney disease, though. Manage your weight. Losing even 5 to 10 pounds can make a real difference in your blood pressure numbers. Limit alcohol. If you drink, keep it moderate. That means no more than 1 drink per day for women and 2 for men. Reduce stress. Find healthy ways to relax, whether that's deep breathing, meditation, time with friends, or a hobby you love. Take your medications. If your doctor has prescribed blood pressure medication, take it exactly as directed, even when you feel fine. These medications work best when taken consistently. Let me be very clear about when you need to reach out to your healthcare provider. Call your doctor's office if your readings are consistently higher than your target range. You're having side effects from your blood pressure medication. You have questions about your readings or your treatment plan. Your numbers are all over the place and you can't find a pattern. Call 911 or get emergency help if your blood pressure is over 180, 120. You have chest pain, shortness of breath, or back pain with high readings. You have a severe headache, vision changes or confusion. You have numbness, weakness, or trouble speaking. Remember, your doctor is your partner in this. Don't hesitate to ask questions or express concerns. There are no silly questions when it comes to your health. Well, my dear friends, we've covered a lot today, haven't we? I hope those blood pressure numbers make a whole lot more sense to you now. That top number, your systolic pressure, shows how hard your heart is pumping. That bottom number, your diastolic pressure, shows the pressure when your heart rests. Together, they tell you and your doctor how your cardiovascular system is doing. Remember, knowledge is power. Understanding what these numbers mean puts you in control. You're not just a passive passenger on this health journey. You're the driver, and you have so many tools available to keep your blood pressure healthy. Whether your numbers are perfect right now or need some work, every positive step you take matters. Every healthy meal, every walk around the block, every time you remember to take your medication, it all adds up to a healthier you. I'm so proud of you for being here today and taking the time to learn about your health. That shows real commitment to taking care of yourself, and you should feel good about that. If you found this video helpful, please give it a thumbs up and subscribe to Senior Daily Living. And if you know someone who would benefit from understanding their blood pressure better, please share this video with them. Take care of yourself, be patient with yourself, and remember, you're doing better than you think you are. I'll see you in the next video, where we'll talk about creating a heart-healthy meal plan for managing high blood pressure. Until then, stay healthy, stay happy, and keep those blood pressure numbers in mind. Take care, my friends.